this is something that's, very near and dear to my heart, as well as something we looked at in detail. We went back over the past, decade or even longer and tried to figure out what MDS patients are being enrolled on clinical trials. And we looked closely at the inclusion-exclusion criteria of a variety of MDS studies, specifically more focusing on phase 2 and phase 3 studies, since these are the studies that move therapies forward and potentially could be practice-changing in MDS patient care. And we noted that a disproportionate number of studies excluded patients with therapy-related MDS, so patients that have prior chemotherapy, radiation, or exposure to both for another cancer, and then develop MDS as a result of those exposures, appear to be excluded from a significant proportion of these studies. And the hypothesis was that maybe this is happening because patients with therapy-related MDS potentially could have worse outcomes, could have more high-risk disease, and therefore might confound the results of these studies. We do note that more recently there has been an effort to include more and more therapy-related MDS patients in MDS studies. And I think this is really important because they represent about 20 to 30% of all newly diagnosed MDS patients. Are patients that have been treated for multiple cancers, are living longer and developing disease with MDS. And so I think our findings show that we really need to make an effort to harmonize inclusion-exclusion criteria and not preferentially exclude patients with therapy-related MDS.